I'm Megan Mitchell Cantrell, and I have the pediatric patient with cystic fibrosis. What is cystic fibrosis, or CF for short? Cystic fibrosis is a disease that causes mucus in the body to become thick and sticky. This paste-like mucus builds up and causes problems in many of the body's organs, especially the lungs and the pancreas. Cystic fibrosis is a genetic disorder. A child must inherit a specific gene from both parents to get cystic fibrosis. People who have cystic fibrosis can have serious breathing problems and lung disease. They can also have problems with nutrition, digestion, growth, and development. There is no cure for cystic fibrosis, and the disease generally gets worse over time. This next slide will show you the organs affected by cystic fibrosis. Those organs would be sinuses, lungs, skin, liver, pancreas, intestines, and the reproductive organs. Who gets cystic fibrosis? Approximately 30,000 children and adults in the United States have cystic fibrosis. An additional 10 million more, or about 1 in every 31 Americans, are carriers of the defective CF gene but do not have the disease. Cystic fibrosis is most common in Caucasians, but it can affect all races. About 1,000 new cases of cystic fibrosis are diagnosed each year. More than 70% of patients are diagnosed by the age of 2. More than 45% of the cystic fibrosis patient population is age 18 or older. The predicted median age of survival for a person with cystic fibrosis is in the late 30s to early 40s. So what are these symptoms of cystic fibrosis? The severity of cystic fibrosis symptoms is different from person to person. The most common symptoms are very salty tasting skin, persistent coughing, frequent lung infections such as pneumonia or bronchitis, wheezing or shortness of breath, poor growth or weight gain in spite of a good appetite, and small fleshy growths in the nose called nasal polyps. This question came up many times while I was doing my research. Does a lung transplant cure cystic fibrosis? The answer is no. A lung transplant will not cure cystic fibrosis because the defective gene that causes the disease is in all of the cells in the body, not just in the lungs. While a transplant does give a person with cystic fibrosis a new set of lungs, the rest of the cells in the body still have CF and may already be damaged by the disease. In this next slide, you can see a picture of the healthy lungs versus a picture of lungs with cystic fibrosis. In the healthy lungs, you see the bronchial tubes are unobstructed versus the lungs with cystic fibrosis, you see the bronchial tubes are blocked by mucus. Is there a cure for cystic fibrosis? There is currently no cure for cystic fibrosis. However, specialized medical care, aggressive drug treatments and therapies, along with proper nutrition, can lengthen and improve the quality of life for those with cystic fibrosis. How does cystic fibrosis affect daily life? Each person with cystic fibrosis follows an individual treatment program. For many, life consists of a daily routine of physical and inhalation therapy to keep the lungs free of congestion. It also includes a high-calorie diet and regimen of pancreatic enzymes and vitamin supplements to ensure adequate nutrition. The life expectancy of people with cystic fibrosis has drastically improved over the last 3 decades. Modern technology and intensive cystic fibrosis research has resulted in innovative and effective cystic fibrosis treatment plans. As a result, people with cystic fibrosis can live well into adulthood if they are otherwise in good health. The forecasted life expectancy of babies born today is 40 years old. Infants who have normal pancreas function, however, are expected to live past 50 years old. Most people with cystic fibrosis lead normal lives. They go to school, pursue challenging careers, play sports, enjoy active social lives, and have families of their own. However, lung disease eventually places increasing limits on their daily lives. Cystic fibrosis treatment. People living with cystic fibrosis must follow a regular treatment routine to stay healthy and maintain optimal lung function. Treatment for cystic fibrosis usually begins with techniques to trigger strong coughs that help loosen and clear thick mucus from the airways. Airway clearance is just one part of the treatment routine. Nutrition and drug therapies are also important for children and adults with cystic fibrosis. The most common medications for cystic fibrosis. Tobramycin, or Toby, is an antibiotic used to treat Pseudomonas aeruginosa, which is a bacteria that grows in the lungs of many people with cystic fibrosis. Pulmozyme is an inhaled solution. The dental side effects would be pharyngitis. Pancreatic enzymes. Most people with cystic fibrosis take pancreatic enzyme replacements whenever they eat to allow them to absorb nutrients and avoid the discomforts of malabsorption. Anti-inflammatory medications are sometimes prescribed to people with cystic fibrosis to help reduce swelling of air passages and improve lung function. Many people with cystic fibrosis use medications called bronchodilators to help improve lung function. Azithromycin is an antibiotic that is used to treat infection in people with or without cystic fibrosis. And an inhaled hypertonic saline is a promising new treatment that can help thin secretions and reduce respiratory infections in people with cystic fibrosis. Inhaled drugs are commonly used in cystic fibrosis care because they reach the airway quickly and easily. Inhaled treatments can be given by aerosol. The medicines go into a cup or nebulizer that is attached to a small air compressor. The compressor blows through the cup and makes a mist. The mist is then breathed in through a mouthpiece or mask for several minutes. This next slide shows a demonstration of children using a nebulizer. Okay, so let's meet Sophie. Sophie is a 6-year-old Caucasian female. She was diagnosed with mild to moderate cystic fibrosis at the age of 18 months. Her medications that she is currently taking are Pulmozyme, pancrelipase, hypertonic saline solution, and tobramycin. Sophie's mother brushes her teeth 2 times a day using what she calls a fun-powered toothbrush. She said that Sophie was much more interested in brushing her teeth once she started using a neat Disney princess toothbrush. Because of the mucus, coughing, and diet, the older Sophie gets, the more dental problems she is likely to have. Given that cystic fibrosis patients suffer from gastrointestinal malabsorption, frequent infections, an increase in energy expended during rest, they are advised to eat a high-fat, high-protein diet. As a result, they consume foods rich in sucrose to maintain their necessary calorie intake. These patients must eat meals and snacks every 2 to 3 hours with an added amount of salt and chloride, both of which are lost through sweat. Because of the diet, these patients may be at high risk for dental caries. However, they may have added protection against caries due to their frequent intake of antibiotics and pancreatic enzyme supplements. Patients with cystic fibrosis have altered amounts of calcium and phosphate in their saliva, which can lead to higher calculus formation. Medications may cause xerostomia and/or the quality of the saliva may be altered. Low levels of vitamin K may cause excessive gingival bleeding. From a practice standpoint, hygienists caring for cystic fibrosis patients should use short appointments, avoid aerosols. This includes ultrasonic scaling and air polishing. Take frequent breaks if needed, or break the appointment into several appointments. Ask the patient how far they can lie back in the dental chair. The dental chair should be positioned so that it can aid in respiration and mucus drainage. As a dental hygienist, my oral home care recommendations for a patient with cystic fibrosis will be to focus on preventing caries and to maintain healthy oral tissues, which will decrease the number of oral bacteria. A patient should do this by brushing, flossing, and using mouthwash. The patients that experience dry mouth from medication should use Biotene or Listerine Zero for their mouth rinse. Some important things to remember as a hygienist when treating a patient with cystic fibrosis is that the patient usually will take prophylaxis antibiotics to prevent lung infections. Also, patients with cystic fibrosis are not considered candidates for nitrous oxide. This last page is just a page of my references.